Hi there, my name is Sergei Vosko, and together with Dr. Sunil Gupta, and on behalf of the co-authors of our study, Dr. Shahidi, Hurigan, Hatem, Barishai, Schumann, Lee, Burgess, Sidhu, and Professor Michael Berg, we will be discussing important aspects of our study that just published in Endoscopy, entitled Snare-tip soft coagulation is effective and efficient as a first-line modality for treating intraprocedural bleeding during Barrett's mucosectomy. So, Dr. Gupta, would you mind to tell us a bit more about our study?
Yeah, absolutely. So endoscopic mucosal resection, or EMR, is the dominant treatment of choice for Barrett's neoplasia, with the preferred method being multi-band mucosectomy or MBM therapy. Despite its favorable safety profile, the frequency of intraprocedural bleeding, or IPB, with MBM therapy can be upwards of 30%. And this is potentially concerning as it can obscure visualization of the working field and therefore compromise the safety, efficiency, and accuracy of MBM therapy. Whilst there are traditional hemostatic modalities, including hemostatic forceps, mechanical clips, and argon plasma coagulation, they are cumbersome and may require catheter exchange and even mucosectomy apparatus disassembly. There is an alternative, being snare-tip soft coagulation, or STSC, and whilst this has proven to be efficacious in the colorectum with hemostasis achieved in upwards of 91% of patients, its role in MBM-related IPB actually remains unknown. So we sought to conduct a study to evaluate the safety, efficacy, and efficiency of STSC therapy as a first-line modality for the treatment of IPB during MBM for Barrett's neoplasia.
Thank you for that. And now if we can also discuss briefly the design of our study.
Yeah, sure. So our study was conducted over a 5-year period up till November 2019, whereby consecutive patients referred to 2 Australian tertiary referral centres for the endoscopic management of Barrett's neoplasia were enrolled in a prospective observational study. Any flat, irregular, or nodular areas of Barrett's neoplasia with prior biopsies demonstrating high-grade dysplasia or intramucosal cancer were candidates for MBM therapy. All resections were performed with a fractionated current, and MBM-related IPB was defined as bleeding that persisted for longer than 60 seconds without any response to water jet irrigation.
And how was the STSC performed?
Yeah, so to perform STSC, we used the snare provided as part of the Duet apparatus. The snare tip was positioned 1 to 2 millimeters beyond the end of the snare sheath and then gently applied to the bleeding point for about 1 to 3 seconds using soft coagulation. Application was repeated up to 5 times to achieve hemostasis. Any persistent bleeding was then treated by hemostatic forceps.
And finally, if we can discuss the results and implications on everyday practice.
Yeah, sure. So we performed 292 MBM procedures in 191 patients. IPB occurred in a total of 63 MBM procedures, and of these, 51 underwent STSC as first-line modality. Hemostasis was achieved in 48 cases, or 94.1%, where STSC was utilized as first-line treatment. In the remaining 12, this was not performed due to concerns of pooling of blood due to multifocal bleeding points. In all cases treated successfully by STSC, there was no need for catheter exchange nor mucosectomy apparatus disassembly. We conclude from our study that STSC therapy for MBM-related IPB is effective, with hemostasis achieved in 94.1%, and this is very similar to the hemostasis rates achieved in the colorectum following tissue resection. It is also safe and efficient to perform, with no need for mucosectomy apparatus disassembly or catheter exchange. It is, for that reason, inexpensive as well, as no additional equipment is required. It is very simple to perform, as it is already extensively being utilized in the colorectum, and its use is becoming more widespread. So given that it is safe, inexpensive, and effective, it really should become the standard of care for treating MBM-related IPB in the setting of Barrett's neoplasia.
Thank you, Dr. Gupta, and thank you, readers of Endoscopy, for joining us here at Westmead Hospital in Sydney. Hope you will enjoy reading our article.